Altered neurologic function, non-traumatic, S-123. BLS. Ensure patent airway. O2 saturation, O2 and or ventilate as needed. Spinal motion restriction as needed. Position on affected side if difficulty managing secretions. Do not allow patient to walk. Restrain as needed. Monitor blood glucose standing order. Symptomatic suspected opioid OD with respiratory rate less than 12. Use with caution in opioid-dependent pain management patients. Naloxone, 4 mg via nasal spray, preloaded single-dose device. Administer full dose in one nostril. Or naloxone, 2 mg via atomizer and syringe. Administer 1 mg into each nostril. EMTs may assist family or friend to medicate with patients prescribed naloxone in symptomatic suspected opioid OD. Suspected hypoglycemia or patient's blood sugar is less than 60 mg per deciliter. If patient is awake and able to manage oral secretions, give 3 oral glucose tabs or paste, 15 gram total. Patient may eat or drink if able. If patient is unconscious, NPO. Stroke, TIA. Treat per stroke and transient ischemic attack, S-144. Pediatric patients presenting with stroke symptoms should be transported to Rady Children's Hospital. Seizures. Protect airway and protect from injury. Treat associated injuries. ALS. Monitor/EKG. Capnography standing order as needed. IV/IO standing order. Symptomatic suspected opioid OD with respiratory depression. Parentheses, respiratory rate less than 12, SpO2 less than 96%, or end-tidal CO2 equal to or greater than 40 millimeters of mercury. Titrate slowly in opioid-dependent patients. Naloxone 2 mg, IN, IM, IV standing order, may repeat standing order. Titrate IV dose to drive the respiratory effort. Or naloxone 4 mg via nasal spray preloaded single dose device, standing order. Administer full dose in one nostril, may repeat standing order. If patient refuses transport, give additional naloxone 2 mg IM standing order, or naloxone 4 mg via nasal spray preloaded single dose device, standing order. Administer full dose in one nostril, may repeat standing order. Symptomatic hypoglycemia with altered level of consciousness or unresponsive to oral glucose agents. Dextrose 25 grams IV standing order if blood sugar is less than 60 milligrams per deciliter. If patient remains symptomatic and blood sugar remains less than 60 milligrams per deciliter, may repeat standing order. If no IV, glucagon 1 milliliter IM standing order if blood sugar is less than 60 milligrams per deciliter. Symptomatic hyperglycemia with diabetic history. 500 milliliter fluid bolus, IV/IO, if blood sugar is equal to or greater than 350 milligrams per deciliter, or reads high, standing order ×1. May repeat base hospital order. Status epilepticus, generalized, ongoing, and recurrent seizures without lucid intervals. Patients equal to or greater than 40 kilograms. Midazolam, 10 milligrams IM, standing order. Patients less than 40 kilograms. Midazolam, 0.2 milligrams per kilogram IM, standing order. Partial seizure lasting equal to or greater than 5 minutes. Includes seizure time prior to arrival of pre-hospital provider. Midazolam, 0.2 milligrams per kilogram. IN, IM, IV, IO, standing order to max dose of 5 milligrams, standing order. May repeat ×1 in 10 minutes, standing order. Max 10 milligram dose. DC if seizure stops. Eclamptic seizure of any duration. Treat per obstetrical emergencies/newborn deliveries. S-133. End S-123.